It's Dr. Caldwell Miller, the brain doctor with Dr. Miller's Guide to Neurology, and we're just going to talk today about a patient that I followed for a long time with cluster migraines. In a very busy practice like mine, I don't see many cluster migraines. I mean, this is classic. This gentleman was a 39-year-old African-American male, tough as nails, worked hard, just did great. And about every 2 years, he had this cycle of migraines. And that's why we call them cluster migraines. Every day at 4 p.m., he would have a headache. It was severe, throbbing, pounding, bitemporal, photophobia, couldn't stand the light, phonophobia, couldn't stand the sound, nausea, vomiting, just sick as a mule. They're always temporal or retroorbital. His eye would water like crazy. He had a little drooping of that eye when it watered. His nose would stop up. Just terrible. Tried Maxalt, which seemed to work a little bit. And then put him on Imitrex, which really worked well after we got him broken. But what do I do during this cycle? There's several things. I sort of like prednisone, give people a big prednisone bolus, like 60 milligrams for 2 days and decrease every other day till off. It won't hurt them. It's a poison ivy level dose. If they're not diabetic, it won't hurt them. And then I really try to use the Triptans. I don't know. It's just a prejudice, but it just seems like white women or men, Maxalt works better. Black men, Imitrex works better. I've never read that anywhere, but it just seems like so. If this gentleman was 39 and black, I used Imitrex. You can use any of them. I loved it when we could get, Frova. And man, I'd put them on one Frova twice a day for 3 to 4 days. Emerge one twice a day, a long-acting Triptan. But any of them, Maxalt, Zomig, Relpax, Axart are worth a try. DHE 45, he never had to take it, but DHE 45 is a great choice. He just kept having these cycles, and I would blast him with prednisone. So the second time I gave him Tagamet and Visceral, his old, histamine hypothesis of cluster migraines seems to have fallen by the wayside, but I still use it. Tagamet and Visceral 3 times a day, for the 1 to 2 weeks. Not going to hurt anybody, and see what it does. And then, very difficult to do, but the home oxygen. I got him a closed face mask, 30 to 40% oxygen. Just worked like a miracle. But man, try to find home oxygen is really, really tough. His cycles became a little more frequent. I put him on verapamil. He had a little bit of hypertension, so I changed his antihypertensive to a calcium channel blocker. So he took verapamil. Maybe the 10th cycle I saw him after 20 years, Nurtec had come out, and I gave him Nurtec and twice a day. Man, it was great with his home oxygen. I had not tried Ubrevely, but I would. Reval, I would try it as well. So try Nurtec, Ubrevely or Reval. So when a guy comes in with cluster migraine, man, if you get home oxygen quick, get it. But you're usually not going to be able to get it that quick. So put him on prednisone, Tagamet, and Visceral off the bat with a Triptan. Imitrex or Maxalt, my top 2 choices. Then try anything you want to try. Trudescent nasal spray, Ubrevely, Nurtec. So cluster migraines are brutal. And that's how I treated this guy. It really seemed to work fairly well. Kept him on verapamil. You can put him on any of the migraine drugs, any of the antihypertensives we talked about before. So that's cluster migraine. So like, subscribe, more videos later.